This dialogue, Yajamana, is overdue. This dialogue should have been done long time ago because we really need it. We need to talk in action, not just beautiful words on paper. This is what we have been doing for almost 2 decades. It is time to actually up our game. And by upping up our game, we need to roll up our sleeves for results to be realized. And by rolling up, it involves all the stakeholders. It involves us, like in the government, and to show the highest level of the commitment, and to show that the government is highly committed. That's why the vice president is here. It is not only the national minister and the state ministers. When we are expanding, why is it not working at my time? For us again to realize the results, expansion and upscaling, it is a must, this is important. My sister here has mentioned about Juba having about 30 facilities, let's say 28 plus the 2, which make it 30. It is because we designed the rules and regulations we have during the CPA when we were becoming our own state at that time. The rules and the policies that were designed at that time were designed to prevent the crossover of the infections from the southern area of this country. And that's why, like, the southern zone has got more support, the southern zone has got more facilities, but if we try and work so hard to prevent HIV here in the southern zone, what about the central and the northern zone? As we speak, Your Excellency, our data is not accurate, but our data is actually scary. Because like the northern belt of this country is where we almost have got zero support. It's where we have got almost zero services being delivered, but that's where we have got high infections. The new infection is actually very rampant in the northern zone. Now, coupled with the Sudan crisis, we have got fluidity of the border, Your Excellency. People are coming in. And also, we have got a lifestyle in the northern zone and central zone that is a nomadic lifestyle. So that means that we have got a lot of cross-border. That means that we have got a lot of intercommunal crossing over, and nobody knows their status. And even if the small healthcare facilities we have are also offering, let's say, screening. You can be, but you will not get any services because most of you here, Madam Estrin is around, and Honorable Harriet, she's here, and she was a director of HIV. She might correct me. If you test somebody positive in the northern zone, there was nowhere to send that person to actually get services. Because all our services are concentrated in the southern area, especially like in Juba area, especially in Western Equatoria area, and a little bit in Eastern Equatoria, plus lakes, and one facility in Wau, maybe one facility in Awil, and that is it. South Sudan is not these areas. So if we are going to have got a proper dialogue, a high-level dialogue, could we also be honest with ourselves? So I'm urging and I'm calling everybody to actually look into your own paperwork. And I'm beginning with our partners and with our donors. There's this song that I'm being told, Honorable Minister, our principal said so. Honorable Minister, our rules and regulations say so. Now that we are on here talking to one another, could we revisit those rules and regulations, because they are not written in stone. Those rules and regulations were written by us the same way we are now sitting. We need to review what was done about 20 years ago. We need to review what was done about 15 years ago, because we are doing injustice to ourselves. We will be sitting here planning, and we will be just be singing the song. We will not be reaching the target. So I cannot stress that on enough. So I know in the afternoon we will have a technical discussion that is going to go on. Have that in mind. Southern zone has got a little bit of prevention going on, but as we move out of Juba, as we move out of Wau, as we move out of Awul, as we move out of Rubik, these other areas where a lot of population are who do not even know their status, and maybe when they know it, they have got multiple partners. It is the reality of our country. Our country is not designed like the way the Western world is. So when we are talking about like the prevention in the main population, the main population in South Sudan look different. It can be one man with 10 partners, and those partners do not even know like their status. So we have to design prevention based on the context of South Sudan. We are not designing it based on what we are importing, and this is what we have been doing, Madam Estrina. So as you are the one in charge, as the one that you are helping me in delivering these services to South Sudan, we need to look inwards. We need to focus on our own localization. We need to focus on the sustainability part of it. We need to focus on the resiliency of what we have. So we need to have dialogue around those. I know I have talked about like reviewing of rules and regulation, and I will also call on our parliament to try and help us make sure that like the rules and regulation in the country are actually mainstream, and they are made for the whole public to adhere to. Minister of Health is already on the path, of making sure we review our policies, and we are already doing that. I know everybody has spoken, and we will have more people speaking in regard to investment. Investment is highly needed, both or three areas, actually internationally, domestic financing, and private investment should be intentional to make sure that we are combating HIV, AIDS, as we are moving towards the SDG goals of 2030, Africa We Want goals, and the future of the world. I appreciate the Committee of Health for standing with the health sector every single year. For almost 3 years I've been a minister. The Committee of Health will call us. They will sit with us for many hours to try and make sure that we are moving along together. My brother and my senior, who was my supervisor when I was a student, Dr. Malik, I appreciate you with your team. You have worked so hard. I know we did not get like what we wanted this year, but I'm sure if we keep on, fighting, we will be able to reach somewhere. Yajamana 1.3% is not enough to do anything. 1.3% of government financing toward the health sector. That means that the Ministry of Health by itself is getting 0.9% of the national budget. My sister here is getting 0.1. And as we move along, and when you look at it, it's only salaries. And it is only like operational costs. There's no proper capital in it. And when we have capital, that when we deal with all the things we are talking about prevention. So again, the Parliament, I'm appealing. We are having a supplementary budget soon. Could the health sector be made a priority? And I'm also speaking here representing sector of gender and also sector for education. I'm representing the Minister of Gender and the Minister of Education. We need more to be put in the social services. If we don't put more in social services in our country, and then we are lying and we are cheating ourselves. There are complaints that like the Ministry of Health and its subsidiaries like the SAC here and DFCA and you name it, we are not giving services, we are not doing this, we are not doing that. How can we be giving services when we are not being given resources? So can somebody explain to me, how are you supposed to be transporting a patient from point X to point B when you don't have an ambulance? So it is a reality that like we need to accept. We need to accept that the more we invest in health sector, the more the services will actually get better. The more our people will not just die of this thing that they should not be dying of. The impact of climate change is actually making it also difficult to make sure that we give services. Climate change should be factored in it, Madam Estrina. When we are planning our policies, we should carve our policies around climate change. HIV is intertwined with climate change in one way or another. We want it or not, it is a fact that we have to deal with. For example, now we have got flooding, and this flooding comes waterborne diseases. Northern part where there's concentration of a lot of people, we are fighting cholera. And here in Western Equatoria, we had yellow fever that was there. The neighboring has got Ebola and all this kind of thing. The dynamic of diseases in South Sudan is changing. In Warab area, we have anthrax in human beings. Anthrax, when I was a kid, I only know it in animals. But now it has crossed over to human beings. And when you look closer, it is because the climate change is changing the trend of diseases. Minister of Health, as well as institution under my care, plus the Minister of Gender, Child and Social Welfare, the Minister of Education, we give our full commitment to making sure that we support you, Esterina, to making sure that we are part of this dialogue moving forward. Community engagement by public figures is actually very important. Thank you, Your Excellency, by leading by example. You are here to show your commitment. You are here to show that HIV need a center stage to make sure that we are cementing very well awareness on HIV to encourage people not to be afraid. Last week, if I'm very correct, we had the commemoration of the 20th Global Fund investment in South Sudan. And when I was a child in Kakuma refugee camp, if somebody was to be known in our community that they have got HIV, it was equivalent to death sentence. Right now, it is no more. You know, it is but we just need to identify where do we go, how do we do it, and what kind of support we actually give. So we have actually come a long way. But I'm afraid that like the gain that we did in the last 20 years plus, it is going to be lost. Because if we are not putting more investment, Your Excellency, in the health sector. Your Excellency, on my own behalf, and on behalf of everybody sitting here, I am so much very, very, very grateful from the bottom of my heart for the 3 years almost that I have been a minister. You have always stood by us like the ministers in social sector. We call you on short notice, you come. We even drag you out of your house on the weekend, you come. We call you wherever you go and we come and running to you. We need guidance, you are always there. May God bless you more, and from everybody here, we need to know that we appreciate your guidance. To our donors and our partners, you have always walked beside us. Please continue walking beside us. Do not give up. I know there's donor fatigue. I know there are competing priorities globally, but South Sudan is almost there. We are changing and we are moving toward the direction that like we desire to be there. Continue supporting us, and we appreciate the work that you have been doing with us and the work that you continue to do. I promise our partnership, I promise our collaboration, and I also promise that our partnership is going to be based on honesty, transparency, accountability, and respect with dialogue. So it is not only going to be one-sided. It's not that I'm coming in with the money, so you have to do as you please. No, we are all going to sit down and we are all going to kind of talk, you know, like the best way that we can. Thank you so much, everybody, for coming. I appreciate you all.